Flowcare G Tube. The Flowcare Gastrostomy Tube G Tube is a silicone balloon catheter used as a replacement of an existing gastrostomy tube or as an initial gastrostomy tube during a surgical intervention. Placement of a G tube is indicated for long-term enteral feeding and/or stomach decompression. Flowcare G tubes are available in Charrières 10, 14, 16, 18 and 20. Preparation. A G tube package consists of 2 individually packaged G tubes. The following items are additionally required for placement of the G tube: 50 mm syringe connecting with the tube, sterile gauze, skin disinfectant, gloves. Placement. Position the patient on their back. If possible, explain the procedure to the patient. Check the Charrière size and length of the existing tube. Place gauze around the stoma under the external fixation disc to prevent leakage of gastric fluids on the skin. Deflate the balloon of the existing tube with a Lewis syringe and gently pull out the tube until the tip is out of the stoma. Work as quickly as possible to prevent closure of the stoma. If necessary, place a temporary catheter in the stoma. Clean the stoma side with dry gauze. Use a new Flowcare G tube with the same Charrière size as the existing tube. The G tube has a feeding port and a balloon inflation port. Check the integrity and state of the balloon by injecting the indicated amount of sterile water via the balloon inflation port. Roll the balloon while wearing sterile gloves between thumb and index finger to ensure it is centered on the tube. Deflate the balloon. Apply a water-soluble lubricant or an anesthetizing gel on the tip of the new tube, keeping the outlets clear. If applicable, remove the temporary catheter and place the G tube as far as possible into the stoma. Keep the tube in place and confirm the position of the tip by aspirating gastric contents via the feeding port and by measuring the gastric pH using pH paper. The tip of the tube is situated in the stomach when the pH is lower than 5.5. When there is any doubt, confirm the position by means of endoscopy or X-ray with contrast liquid. Note the pH value in the patient's medical chart. Close the cap of the feeding port. Inflate the balloon via the balloon inflation port with a quantity of sterile water indicated on the tube. Pull the tube gently upwards until the length of the tube coming out of the stoma is identical to the length of the previous tube. Slide the external fixation disc to allow a distance of approximately 5 mm between the external fixation disc and the skin, and fix the tube in the 90 degrees angled disc. Inject 20 to 40 milliliters of water via the feeding port of the tube to avoid an obstruction of the tube. Note the Charrière, the length of the tube introduced, and the amount of sterile water injected in the balloon in the patient's medical records. Care. Inspect the stoma side daily for any redness or swelling. Disinfect the skin daily. As soon as the stoma is completely formed, it is important to wash, rinse and dry the skin thoroughly. Turn the tube daily 180 degrees on its axis and move the tube up and down in the stoma, a minimum of 1.5 centimeters. The position of the Flowcare G tube should be confirmed every time a new Nutrisol pack or bottle is connected, if there is any doubt about the position of the tube, and at least 3 times a day. Verify that the external fixation disc has not been dislocated, and if possible check the pH value of aspirated gastric contents. Flush the tube with 20 to 40 ml of water before and after the administration of feed or medication, and at least every 8 hours to prevent tube blockage. If the tube does get blocked, flush the tube with lukewarm water. Do not use excessive pressure to prevent tube rupture. Use a syringe larger than 20 ml. If this doesn't help, gently squeeze the tube between your fingers along the length of the tube. Do not use any other fluids to flush the tube. Check the volume of sterile water in the balloon weekly. If necessary, fill up the volume to the same amount as documented in the patient's medical records. Replacement and removal of the G tube depends on the integrity of the product and/or on medical indication. Please read the instructions for use on the packaging and guidelines. Immediately stop feeding and ask for medical help in case of doubts concerning the patient's medical condition.